joining us tonight on the Business Show. On behalf of Maurice Owino, my name is Joyce Odur. On the Business Show tonight, we are going to talk to three guests. First of all, we are going to start with Mrs. Jane Wanyama, who is the CEO of the Agakhan Hospital, Kisumu. And then the second part of the interview, we are going to talk to Miss Elizabeth Kamau, who is the Director of Nursing Services at the Agakhan Hospital, Kisumu. And then the third part of the interview, we'll talk to Miss Mercy Kimtai, who is the Occupational Safety, Health and Environment Manager at the Agakhan Hospital, Kisumu. As we begin this show, we are going to talk to Miss Jane Wanyama, who is the CEO of the Agakhan Hospital, Kisumu. Welcome to the Business Show on Lolwe TV. I'll give you a chance to introduce yourself and tell us who you are at the Agakhan Hospital, Kisumu.
Thank you, Joyce. My name is Jane Wanyama. I'm the CEO Agakhan Hospital, Kisumu, and often prefer calling it Kisumu Cluster. Kisumu Cluster because really we have a footprint across the entire lake region, stretching all the way from Migori to Kapsabet to Narok, Bungoma, Busia, Kakamega. We have two centers in town. We are in Homa Bay and we are also in Kisii. And hence we call it a cluster. In total, we have 13 outreach medical centers besides the main hospital. I'm a nurse and a very proud nurse and a nurse midwife. I actually call myself an established midwife.
Okay.
Yeah, and that's Jane.
Welcome to the program. Jane, as the CEO of the Agakhan Hospital, Kisumu, maybe you can tell us a little bit of the background of Agakhan Hospital generally or in Kisumu.
Sure. Agakhan Hospital, Kisumu was established in 1952. Started off as a small dispensary, but eventually has grown to 18 beds to 60 beds by 2000. And today we are talking of having 70-bedded hospital. The great thing is that we actually are looking towards an expansion of the hospital. We are looking at groundbreaking within the next few days. There will be a lot of activity happening here to see our hospital grow to a 110-bedded hospital with, of course, increased capacity in all areas in terms of facility and structure, but additional to that, specialty services in terms of clinical services. A hospital is not just about the building. A hospital is about what it's able to deliver in terms of clinical services.
You can tell us what are some of the programs the Agakhan Hospital offer?
So today, as a hospital, we offer what you would call secondary services with a bit of subspecialty services, and therefore moving towards tertiary services. And this is really across the entire spectrum of healthcare. We have medicine, we have surgery, we have pediatrics and maternal and child health. Some of the subspecialties include oncology, neurology, infectious diseases, orthopedics at specialty levels. We have endoscopies that we do here. We have a well-equipped theater. But besides that, then we also are not just limited to this. When you look at the medical outreach centers that I talked about, some of them, they are all at different levels where we provide what we would call primary healthcare services. This starts with a simple consultation, nursing care, together with some subspecialty clinics that happen in some of those centers. So this vary based on the services that on where the center is and what the demand is. In some of the centers, what we've also gotten is put in some diagnostic services that have gone a long way in meeting and complementing the counties in which we are working in. For example, in radiology and pathology.
Jane, you can tell us since last year, in March 2020, there was outbreak of COVID-19 in Kenya. As the CEO of Agakhan Hospital, how did that affect your general programming, and so far, how have you dealt with it?
So Joyce, I don't know if you remember this. One of the first institutions that actually got a COVID-19 suspect was actually Agakhan Hospital.
Yes, I remember.
And I actually even remember the date. It was 21st of March
2020.
Yes, exactly. And so at that point, we are blessed as a region, as a network, that we have what you call Agakhan Health Services Network, and more so in East Africa.
Yes.
So besides working as an institution, we fit in what the network does. And quickly we got into sitting into boardrooms, virtual meetings led by our regional CEO. And our first thing to do was to develop what we called implement a COVID-19 emergency response plan, but not just an emergency response plan, but also a business continuity plan.
Yes.
So that is what we came up with, and looked at the different factors that are related to the healthcare service provision from A to Z.
Yes.
So we got a team of staffs that sat in as task forces at local levels, but at regional level we had to do that. But this did not actually even stop there. We actually involved our board members. We got meetings happening like on a weekly basis, just asking ourselves, how well prepared are we to be able to tackle this animal when it first gets here?
Yes.
And so by the time COVID-19 became a reality in Kenya,
Yeah.
I can tell you for sure we were well prepared.
Okay.
And how are we well prepared? Some of the things we had to look at included the facilities. So it calls for having kind of what you'd call, we called it a central triage area, where patients would walk in through one entrance. This went a long way in being able to control, so that anybody that was coming in, and if you remember those days, it was, did you have a history of travel?
Yes.
We needed to screen, are you having the temperature or not? And also making sure that we put services of you being able to wash your hands as you come into the hospital, sanitizers and all that. That was not going to happen with multiple entries in a hospital. So it called for us to come up with what we called a central triage area, and this was implemented like within the first month. And so structure-wise, that is what we had to do. Now when a patient walks in, it's possible that you walk in with a headache, and fevers go up and they're not settling, and we start suspecting, might you be having COVID? And so what would happen then is that we had to beef up our isolation facilities from 2 rooms initially to 3 rooms, and even looking at the rooms that we had in at that time, being able to work on them so that they can become better prepared as a facility to take care of patients that are coming in with COVID. The process was to be looked into so that as soon as there's any suspect, then you want to swiftly move this patient from the outpatient to the inpatient, so that the patient can be able to be taken care of. Remember, in the first few days, any COVID patient really was ending up as an inpatient.
Yes.
Time has changed. Today, patients who are actually COVID positive are being, as long as they are stable, they don't have comorbids, they're actually being managed at home. And that has gone a long way in easing the pressure on the hospitals. So it meant we looked at facilities, it meant we looked at processes. Processes in the hospital are guided by guidelines. So our teams were on the run day in, day out, reviewing processes, and there were changes that are coming in every other day. As an institution, we worked with the WHO guidelines and also referenced the national guidelines. So, and up to today, I can tell you for sure, at one point it was, you have COVID, you have to be 100% at home. You have COVID, you can't put 2 people together. You have COVID, I mean, all that. But what has happened is resources have been looked into, processes have been looked into, but those must be guided by guidelines. And so we have guidelines that we've put in place so that we can be able to take care of such patients. Agakhan Kisumu is actually a self-care accredited facility, and in one of our initial times, we had a checklist done by self-care, which helped us to objectively measure ourselves and see if we actually have any areas that we need to work on. And as soon as we got the report of these areas can be strengthened, then we worked on that. You can have a hospital again, like I say. You can have the processes right and everything. But the most important thing that anybody should think of, especially in a situation of COVID-19 or an infectious disease, is your staffs and your patients. You want to make sure that your staffs are fine. And so for staffs, besides these facilities that I'm talking about, the processes that I'm talking about, we needed to make sure that we had enough protective equipment that the staffs can be able to use. And remember, the challenges that came with COVID. Are we going to have enough masks? Are we going to have enough aprons? Are we going to have enough boots? You know, all that. So what we did is made sure we were stocking ourselves enough through our supply chain to make sure that we had enough stock to last us for the longest that it was going to be able to last. And that was not only going to make sure that we don't contaminate between patient and staff, but also just for the staffs themselves, so that they are safe. So we looked at our PPEs, we looked at equipment. No institution today would really stand back and say that they had enough ventilators or they had enough oxygen administration gadgets. But with COVID coming in place, we had to revise our budgets so that now they go towards supporting the impact of COVID on the institution. Getting back to staff, yes, they are staffs, yes, they are healthcare providers, but remember they're also human beings. Meaning they were also pretty exposed. Exposed in terms of they could get COVID. And if they could get COVID, then we needed to come up with arrangements of how do we protect them? How do we take care of them so that they don't get the COVID? And if they got the COVID, how do we make sure that they are still safe? Both at home and at work. And this caused us to think of alternate accommodation plans for our staffs, so that when they turned positive, if they needed quarantine, if they needed isolation facilities, we were able to provide that for them.
How are you providing that for them?
So we came up, we have a staff quarters that we had to refurbish and renovate it and make sure that it had all the facilities that would be required, almost at a home away from home, when during their isolation time. So we did that, and fortunately they all from throughout the region, any staff that turned positive, we were able to take care of them in the staff quarters.
As we come to the end of the first part of the interview, maybe as the CEO of the Agakhan Hospital, in a scale of 1 to 10, how would you rate the preparedness of Agakhan in terms of combating COVID-19 in Kenya?
On a scale of 0 to 10, I'm comfortably say at 10.
You're at 10?
Yes, and I say this with a lot of confidence because even at the starting point, when we were all still wondering what it would take, I know for sure that at any one point, working very closely with our Ministry of, our county government of health, they were very clear, if there's any patient that turns positive, Agakhan is the place to go.
Nice.
So very confident about that.
Thank you so much. Just as you've heard from the CEO of the Agakhan Hospital Kisumu, Mrs. Jane, confident that the Agakhan Hospital is, on a scale of 0 to 10, they are at position 10 and they are ready to combat COVID-19 in Kenya. We're going to take a short break and then we'll come back to the second part of this interview where we'll have Miss Elizabeth Kamau, who is the Director of Nursing Services at the Agakhan Hospital. Don't change that channel. Welcome again on the second part of the business show on Lolwe TV, and the second part of this interview we are going to be with Miss Elizabeth Kamau, who is the Director of Nursing Services at the Agakhan Hospital Kisumu. She's going to talk about the changes COVID-19 brought in terms of healthcare provision at the hospital and vaccination and so many other things we are going to talk about in this second part of the interview. I'm going to give her a chance to introduce herself and tell us more about herself, and then we continue with this show.
Thank you, Joyce. My name is Elizabeth Kamau. I am the Director of Nursing Services in Agakhan Hospital Kisumu. And talking about COVID-19, what happened was that we had to address a whole change of how we transacted our businesses, our business being healthcare. And so what happened is we came together as a team and we came up with a plan in the institution, and can't tell you that that plan has been very fluid because of the changes that have happened. And in that plan we looked at provisions of resources for the staff, and other than provisions for resources, we needed to keep the staff informed on the new happenings and the expectations. We also made sure that we trained staff we had training programs for all cadre of staff on how to take care of themselves and of the patients, making sure that they keep themselves safe and they also keep their patients safe. So we rolled out trainings not only for the clinical teams, but also for the non-clinical teams who are working in the hospital. We made sure that our trainings were geared towards providing information, use of PPEs, use of what they needed to do frequently in the hand hygiene, because we had made sure that we had increased the hand hygiene points. So we kept them engaged in the many forums that we held at departmental levels, at institutional level. We had regular briefings. We used to have on a daily basis all the leadership meeting of the clinical heads, and then on a weekly basis we had to have forums for the staff. At departmental level we also made sure that we had forums, and the CEO started having very frequent forums also with all the staff, both here and at the outreach centers. We also developed a process that made sure that we screened and identified early those patients that may be infected or people that were suspects, and it was by removing the outpatient department out of the main hospital. So we had to use a facility whereby screening and triaging took place, and any person who had symptoms that would have led to suspicion, then they were seen at that area. So we engaged even the private consultants who visit the institutions, because they had also to review their patients in that area. In collaboration with our support services like diagnostics and pharmacy. Diagnostics also, we got the lab coming to draw samples from the area. We keep away whichever suspect that we got from the hospital. So any drugs were also issued at the OPD annex. However, if a patient disciplinary team working together.
As the director of nursing services at the Agakhan Hospital, I want you to talk about the COVID-19 vaccination that is now going on in Kenya in different health facilities. There are some of myths around the vaccination. Maybe you can shed some lights on what people really need to know about the COVID-19 vaccination.
Okay, there have been myths going around, and unfortunately even some healthcare workers have not had the vaccination because of the myths. And when it was introduced by the government, and particularly I'll talk about Kisumu County, we were all called as stakeholders, and we went through demystifying the vaccine, and we got information on what we should actually tell our people. And what we did was to come and talk to our staff and say what the COVID vaccine did, not what it didn't. Because really the key message is that it will not protect you 100% not to have the COVID infection, but what does it do to your body? It protects you in that even if you get the COVID vaccination, the COVID infection, then it will not be as severe as if you were not vaccinated. However, we know that many people have been skeptical about it, and my one message to them is, for those that are parents like me, we take our patients for measles vaccine. Does that mean that the child does not get measles? They do get measles, but they get it at a milder form. So you'd rather get it at a milder form than in a more severe form. The other question has been, once we are vaccinated, should we stop the COVID measures? No, we shouldn't. Because we've even had people who have had 2 doses. I was actually just reading an article of somebody who has had 2 doses, and they've already the COVID infection, but it has been very mild. So are there side effects like any other drug? Then you expect some side effects. Some would be locally, like at the site of injection, it will be sore for a few days, and other may get some headache, you may get some tiredness, and that's the reaction that the COVID vaccine is supposed to elicit in your body, so that you actually get antibodies against the COVID infection.
You can talk about the testing.
Yeah, so as an organization, what we've done is that we don't have the capacity today to test for the COVID vaccine, COVID-19. But what we've been doing is sending our samples to Cambridge, CDC Cambridge, and other samples to AKU Nairobi, Agakhan University Hospital Nairobi, and we are in the plans of acquiring our PCR machine, and we've already had the structure built, and very soon we are going to have that, and we will definitely communicate on when we will start testing in-house.
If you say PCR machine, maybe what kind of machine is that?
This is the machine that actually tests for the COVID vaccine, amongst other. Amongst others. I will not talk of the long name of what PCR means.
Okay, Elizabeth, maybe as we come to the end of this show, your parting shot to anyone who is watching you right now.
My parting shot is that COVID is real. I know I've had people talk of that COVID is not there. COVID is real. We've had staff infected. We've lost colleagues. We've lost family members. So let's all take care.
Okay. Yes. Thank you.
Thank you.
Just as you've heard from Elizabeth Kamau, who is the Director of Nursing Services at the Agakhan Hospital, Kisumu, even after being vaccinated against the COVID-19 so rampant in our society today, make sure that you still put in place all the precaution measures that helps you not to contract the virus, since getting the COVID-19 jab or the COVID-19 vaccination is not a surety that you cannot contact the COVID-19 virus. We'll take a short break and then we'll come back to the third part of this interview. Don't go away. Welcome to the last part of this interview on the business show on Lolwe TV. And just as I promised, today on the business show we are going to have 3 guests on set. Now we are on our third guest, who is Miss Mercy Kimtai, who is the Occupational Safety, Health and Environment Manager at the Agakhan Hospital, Kisumu. Welcome to the business show program on Lolwe TV, Mercy.
Thank you.
We can start by introduction. You introduce yourself and what you do at the Agakhan Hospital, Kisumu.
Great, thank you. First is thank you for the opportunity to have us here today.
Yes.
And my name is Mercy Kimtai, as you said it, and I'm the manager in charge of Occupational Safety and Health at the Agakhan Hospital, Kisumu. And as the name suggests, my role is to ensure that the healthcare providers, as they're taking care of the patients, they're safe.
Okay.
Yes. So basically, that is what I do, and also that the operations, whatever we do at the Agakhan Hospital, Kisumu, does not in any way pose harm to the environment.
Okay.
Yes.
Welcome to the show, Business Tuesday.
Thank you.
Mercy, as the Occupational Safety, Health and Environment Manager at the Agakhan Hospital, what are some of the occupational and safety measures you've put in place for the general workers at the Agakhan Hospital? If you'll begin with there.
All right. Thank you very much. First is I need to let you know that the Agakhan Hospital Kisumu leadership is very committed to ensure the safety of workers. And as such, we have put in place a policy framework here that outlined the commitment of the management to ensure the safety and health of the workers as they are executing their duties. So we have a safety policy in place that guides us on what we need to do, and a myriad of programs have been set, starting off with the medical surveillance. So we appreciate that where human activity exists, there are some risks that will come along with the activities that we do. And with that in mind, we constantly do risk assessment to identify the potential risk in the workplace and be able to put in place mitigation measures to eliminate or bring down the risk at the work. So one of the ways is to time to time. So on entry, we're able to check your to just check your medical status, that you're fit for the job, and the job that you're going to do. Yeah, and that is not in any way used as a form of discrimination, you know. Yeah, so we do that on entry. We do periodic for certain type of work that expose you to certain hazards. For example, for radiology, there's radiation exposure to radiation.
Yeah.
So we do annual medical examination and also biannual hemograms, just to check and make sure that, you know, our staff are not exposed and we are not aware.
Yeah.
Yeah, and also we're able to do that at the end of service, that is at the point of exit. Yeah, so we are constantly monitoring our staff health. Yeah, we also have established a robust employee support, psychosocial support system. Yeah, so and this came in strongly, or rather we enhanced it during COVID. When COVID struck,
yes,
we noted, I mean, there was a lot of anxiety, there was a lot of stigma, and we had to deal with a lot of mental battle more than the physical. The whole world was shut down, and the healthcare workers on the forefront. And you know, we are still human at the end of the day. We had fears for ourselves and also for our families. And so the psychosocial support had to come in very strongly, where we had group psychosocial support programs and also individualized, depending on individual needs, at the time. We've also implemented a staff vaccination program, which, of course, aside from hepatitis B, we also do influenza vaccination to the people at high risk, and also now with COVID, we have we've taken on board the COVID vaccination. So we're able to vaccinate our staff just to protect them
from COVID.
From COVID as well. We take seriously staff training because we know knowledge is power. Yes, it goes a long way. When you're aware of an hazard in a workplace, then it helps you make informed decisions and to work without exposing yourself. So the management has invested a lot in training. So we have safety committees, well-trained safety committees represented across the facility, and even the cluster, as mentioned earlier. Physical measures have been put in place, like improved ventilation, just to to minimize the risk of potential infection as a result of the work environment, considering the kind of risks, we deal besides COVID. We are in a healthcare. So ventilation is a big thing for us. And also when COVID struck, then we also had to relook at that. Risk assessment kicked in, and we had to identify and one of those that we identified were our service points, which were half, open. So that had to be, we quickly identified that and put up barriers. So you will notice that our service desk changed. We have glass barriers around it just to minimize the risk of exposure to staff when they are giving the service, the much needed service to the public. We also, the hospital takes very seriously staff engagement. So we have several forums that give the healthcare workers an opportunity to interact and raise their concerns directly to the CEO, directly to the HR team. So we have CEO forums that run monthly, that came in handy and actually was enhanced during COVID season, because we all needed some form of assurance, and that we saw that improve, and it went a long way to allay anxiety that was already with the staff.
Mercy, the CEO said that Agakhan first patient who had COVID-19 on the 21st of March 2020. Since then, up to date, as the occupational safety, health and environment manager, what measures have you put in place to ensure that all the healthcare workers at Agakhan Hospital are protected and do not contact COVID-19 in one way or the other while at work?
Yes, thank you. And one of the things that we put in place was to review process. Yes, initially then our customer flow process into the facility was from different entries and different triaging points. So quickly we had to, review that process and have a central triaging area and be able to, detect and isolate any potential or any suspected case at that point before even they gain entry into the hospital. So that was to separate as much as possible. Then of course enhance PPE provision. So the PPE provision was enhanced, and that was never compromised at any one time. Even when there were global supply chain challenges, the organization had already gone ahead and stopped
And
for a long period of
talking
time.
of PPEs,
Yeah.
Mercy, there were allegations of fake PPEs getting into the countries and in different health facilities.
Yeah.
How did Agakhan Hospital ensure that all the health workers get the right PPEs to be used?
Oh, great. How we ensure that happened is through our procurement process. We are able to do a PPE evaluation.
Yeah.
And this was done both at the regional level, not just at Kisumu, but at regional level, East Africa, Agakhan East Africa, and also at the head office.
Yeah.
Yes. So we were able to do PPE evaluation at that point. When before they come in, they're evaluated, and we are confident that it meets the specifications.
Yes.
Yes.
Okay.
Yeah, and that is an ongoing process. For any new PP that we are getting, we do PP evaluation. Yes, before we get it in.
I don't know if you've had a case at the Agakhan Hospital in a situation whereby a healthcare COVID-19. How does Agakhan help these healthcare providers, provided that the person has a family and maybe COVID-19 treatment? How does Agakhan deal with such a case?
Yeah, thank you. We've come a long way. And at start, we would, when the stigma was very high and a lot of, anxiety out there, so any potential case of exposure, like you've dealt with a patient that we suspect would have COVID, would call for a quarantine, isolation from your family and the rest of the staff. So what the organization do, they establish, we have a staff quarters, which was quickly changed into an isolation or quarantine center. So where staff has been exposed, then would be provided with an alternative accommodation where they are made as comfortable as possible. It was literally like, so it's more like you're at home. Meals are provided, and there were constant follow-up, just to give psychosocial support to yourself and even to the family. So that went on during the quarantine season, even up to when we now got into proper isolation cases where somebody, a staff tests positive. Yes, the facility is still in the staff quarters and monitored up to when they are safer to go back home to their families. Yes. And it actually didn't stop there, because then we were doing a lot of psychosocial support and even contact tracing and support to the families as well. Yes.
And what about the medication of the bills, medical health workers who have contacted COVID-19? I say you cannot tell whether they contacted COVID-19 in line of duty or outside. The medical bills, does the hospital cater for it, or how?
Yes, the hospital has a very enhanced medical cover to staff. Yes. And when COVID came in, that that communication came to staff that, hey, the hospital is taking up your medical any medical expenses that may come as a result of COVID. Yes. So that is 100% taken care of by the hospital, and it takes away the burden from the staff.
Thank you. Yes. As we come to the end of this interview, maybe your last word that you can leave viewers with.
So as we are celebrating this year's World Day for Safety and Health with the theme of anticipate, prepare, and respond to crises. Yes. Challenging businesses and employers to invest in resilient OSH management system. There is no better way that could have been tested in the past other than during COVID. Yes. Because it really brought in a new challenge to the field of occupational safety and health, where we had to redefine, we had to be creative and redefine new ways of doing things. So as a hospital and also as a safety professional, I would we really appreciate that the organization, the hospital, has gone a long way to ensure the protection of healthcare workers while at work, and there's so many other opportunities to enhance occupational safety at work out there, and we challenge other facilities, other businesses, other companies. Occupational safety and health, as it goes a long way to enhance productivity, because a safe worker is a productive worker. Yes, and that would be my parting shot.
Thank you. Just as you've heard from Mercy, who is the Occupational Safety, Health and Environment Manager at the Agakhan Hospital, she has said that a safe worker is a
productive worker.
That brings us to the end of the show, the business show on Lolwe TV tonight. Until we meet again next time, have a good night.